I interviewed Tina Hardy. She has been practicing as a registered nurse for 29 years in Columbus, Ohio. The first question I asked her is what is meant by the term evidence-based practice. She says that the term evidence-based practice means to use research, evidence, and expertise to guide clinical decisions and care. She says without evidence-based practice, the role of a nurse would be more of a trial and error, and that is not beneficial or effective for the patient. An example she gave me was knowing about personal protective equipment and the role it plays in preventing hospital-acquired infections. The second question I asked her was, did you learn about evidence-based practice in your undergraduate nursing program? She says that she did not learn about evidence-based practice in school. She went to school about 29 years ago, over 29 years ago. So it was not, she did not learn about it in school, but she learned about the same concepts, but the model that we're learning today in school was not around, so no. I asked her another question: in what ways do you use evidence to guide your daily nursing practice? She says that she always uses evidence-based practice to guide her decisions in her patients' care. She says that she can always use it as a backbone when she's facing a tough decision or she's not sure what to do with specific patients. She uses research to help her guide and make better decisions. I asked her to give me an example of evidence-based practice project in her unit that's been conducted in the last year. She says one thing that her hospital is very serious about is hand hygiene. Like most hospitals, there are signs posted throughout the hospital, articles, research studies in break rooms and offices that are constantly posted, she says, in her hospital to remind nurses and other healthcare professions about the importance and new research and things like that found in the hospital. The final question I asked her was, in your opinion, how important is it for undergraduate nursing students to learn about evidence-based practice? She said, I think it is very important because it is vital to patient care. Evidence-based practice is like the backbone to proper nursing care. She says it increases patient satisfaction, decreases infection, and just increases overall patient outcome. Always using, obviously, what the patient wants, but also having your own expertise and research and knowledge about the situation. And she said that basically it's just super important, and to be a good nurse, you have to have a good concept of evidence-based practice.